It's Speaking with Gravity, and I am Curvin, one of your hosts.
I'm D.
And I'm Taisha.
And on this podcast, we talk about mental health and how everything affects everything. You see, when you sit with the therapist, the conversation is different. With every episode, the goal is to have a conversation that makes you think, make you feel, make you do what's best for you. I'm a therapist, we're a therapist, but this isn't therapy. It's a podcast. So today we have another disclaimer.
While we serve as mental health professionals, the information and content being discussed during our podcast is not intended to be utilized or substituted as therapy. The purpose of this broadcasting is to share our personal perspective through open dialogue about various content based on our personal, educational, and professional experiences.
And once again, as I did on a previous episode, we're introducing the QD of the hour, quote of a data. Is our version of fun facts that gives you information that you'll be able to give to your friends, your family, your colleagues, your co-workers, your church members, so that you can let them know that you know about mental health or whatever it is, whatever topic we're coming from. Today, this is an extension of the therapy edition that we did last episode. So, fun facts. I'm going to give you 3 of them once more and again. In individual therapy, I don't know if y'all would agree with this. Some of y'all probably will. In individual therapy, a great therapist challenges a person's thoughts and behavior patterns. Also, second fun fact, marital or couples therapy and family therapy require less time than the average individual treatment. They say marriage and couples is usually about 11 sessions, 11 and a half sessions. I don't know if you could do a half a session, but 11 sessions, and then family therapy would be 9 sessions as opposed to individual therapy being 13 sessions. That was a new fact that I didn't know about. And then lastly, when you look at all the studies that have been done about which one is more, the outcome is better, whether it be individual therapy or group therapy, they really couldn't come to a conclusion that individual is better than group. I would have thought individual would have been better, but based on, and there are some studies that would say group, and there are some studies that would say individual, but when you have all of them side by side, they come out about equal. That was surprising to me as well. So, again, this is an extension of the last episode. We talk about why to go to therapy, what therapy is about, how to find a therapist. But we also want to just go a step further than that and talk about the different types of therapy. Now, there's a whole bunch, but we're going to focus on individual, couples, family, and group therapy, just to give you some insight onto that. But before we go to that, when we're talking about therapy, usually people think mental illness. As we said previously, no, doesn't have to be mental illness. And also people get mental illness and mental health, I'm going to say confused. Mm-hmm. They use them interchangeably.
Yeah. Interchangeably.
Yeah. I'm getting one of these days. Of these days, I'm gonna take. No, I'm not. I'm lying. I'm not gonna take no classes. I'm just gonna be who I'm gonna be. Mental illness and mental health. So when we talking mental illness and when we talking mental health, y'all want to define that? I got my definition written down here that I want to give to the people. What y'all say?
I think of in terms when you're talking about mental health, and y'all know how I am with my analogies. I think of mental health being an overall well-being of your mental state. So just as your physical health it's really something that every person has. You don't have to do anything to obtain it. it's a natural born given aspect. So every person, young, age, elderly, whatever, has a mental health. When we talk about mental illness, I think of things that have occurred or are happening that alters your actual state of being, just as in relation to your physical health, right? So everybody has a physical health. We're all born with certain conditions, and then as life occurs, there may be things that transpire within us. When you're talking about terminal illnesses and things of that nature, that's mental health illness. Maybe something that is something that is lifelong, or it can be something that may just be occurring, like you might get the flu, or you might get a cold, or you might have sinuses or something. That's something that may occur within, and you may need treatment or support in order to overcome it. And sometimes it's a lifelong adjustment, because it may be something that occurs occasionally, or as something happens, and so therefore you may need support or assistance in getting it. So when we're talking about mental health, I think again it's the overall health of our mind, and our emotions, and our spacing. And then when we're talking about mental illness, we're talking about a direct impact to our mental health, and that can be mild, it can be moderate, or it can be severe. And so and as things transpire, or as we go through certain things, that the stages of that may get worse, right? Depending on the intervention method. So you know what I'm saying? Just as in with your physical health, again, there's certain stages of cancer. If caught early enough, treatment can prevent further exposure and things of that nature. However, if something goes on for an extended period of time, it may get to a place of where it's irreversible and there's nothing more that can be done. And so that's the same thing with mental health. When things are happening to us, if caught early to really be addressed, there are techniques and practices that can be implemented to kind of resolve the issues that we may be experiencing on a mental and emotional or psychological aspect. But if not, then it's something that can extend on and lead to severity of mental illness. That's not different.
What say you, Miss Ty?
Again, Dee kind of said that all in a nutshell, but I do think just like physical health, we all have mental health. Mental health involves effective functioning in our daily activities, resulting in productive activities such as work, school, healthy relationships, and our ability to adapt to change and cope with adversity. I found that definition on Google, by the way. Whereas mental illness, it refers to collectively all diagnosable mental disorders such as anxiety disorders, because there are different forms of anxiety, as well as mood disorders. We're talking bipolar, depression, things of that nature.
I love how you said the ability to adapt, and you said ability to adapt and something else.
Ability to adapt to change and cope with adversity.
Okay. I looked on Google too, right? And mine said cope with stressors, but very similar. And when you think in mental health, we don't just go around and say, this person's in good mental health. We don't say that, do we?
Right.
But we probably should, because it's good mental health as well as bad mental health. When we say mental health, we automatically go towards, something's wrong, something bad. But people literally can be in good mental health, and they can go and do things to maintain that good mental health, or to put themselves in that good mental health. We're just sitting here listening to Big Sean, and he talks about meditation that leads him into good mental health, and how to navigate through what we call life. Life is different for every single person, and so their mental health is, as you said, impacted in so many ways by various things that we come across. And then that can lead into mental illness by impairing us. But one of the things I saw that I don't think y'all mentioned, and I don't know how I feel about it, it said mental illness is an abnormal brain activity. And I know it can be in certain instances with certain diagnoses, but I don't know if I want to place that on every illness. And then again, I ain't a doctor. That's why I'm not a doctor, because I haven't went and studied it as far. But that was one of the definitions And then, of course, based off of that abnormal brain activity, it affects your mood, it affects your behavior, and it impairs you to a degree that it affects how you function from day to day. That's probably the biggest thing, though. How do we function from day to day? That's where your mental illness come in at. If it stops you from doing what you would normally do, then that is a good sign that there is a problem. Yeah. And so, just to address, well, we said it previously, you don't have to have a mental illness to come to therapy. In order to maintain a mental illness. Maintain good mental health. Therapy is a good approach. And the first one that comes to mind is individual therapy. What does that look like? What does therapy look like? Individual therapy look like? And for me, it would be, I saw this too, understanding somebody's history, understanding their fears, understanding their insecurities. When you talk insecurities, what's her name? Brene Brown. She talks about being vulnerable.
The daring way.
Did you did something with them, didn't you? Or you went to training or something?
I didn't participate in the daring way training offered by Brene Brown, but I know a few clinicians that I met at the Black Therapist Rock who participated in that training, and I've heard great feedback from it. Definitely something I would look forward to doing. She also has a documentary. It may still be on Netflix. I'm not sure, but if it is, I would encourage all of our listeners just to check it out.
You know the name of that documentary?
No, I don't know the name, but just type in Brene Brown. Is it The Daring Way?
I'm gonna have to look it up real quick. Now, it might be The Daring Way, but yeah, it's a pretty good documentary. I'm gonna look it up here while you give us your insight on individual therapy.
You referring to me?
Yeah.
Oh, okay. So I think of individual therapy looking as a one-on-one guide for life maintenance. As you guys have stated, life happens to us. We all experience our own level of adversity, and what that looks like from person to person is so different. And one of the things that I think is so significant about individual therapy is that it is specifically geared towards helping that individual increase their mental health, because our mental wellness, in terms of what we're looking at, from a healthy standpoint. I like where you said good mental health, because I think it really dismisses the stigma that mental health, when you're referring to it, we're always talking about it in terms of mental illness and it being negative. And I think when we look at the history of mental illnesses and things of that nature, and I kind of have an issue with that concept of abnormal, because I think when you start using that language, and again, I'm not a doctor either, this is just my personal aspect, personal thoughts, is that when you say the word abnormal, then what defines normal? And that normalcy for every person is going to be different based on where they are, where they're located, what they're experiencing. And so that definition for me didn't kind of go sit well. But again, I digress. So, really just kind of for me, the individual, as I stated, is really that just one-on-one interaction of exploring what that individual needs in order to help them achieve the functionality of their day-to-day interactions and what they do.
Yeah. And then, when we talk in individual therapy too, we have to think about, I saw another fact, I guess you could say, that says progress in individual therapy comes a little bit faster. I guess it could be common sense. Comes faster if you do it from week to week as opposed to bi-weekly. But we talked about in the last episode homework exercises, and with those homework exercises, when you're going week to week, number one, I can assign you a homework assignment. and then process it the next week, and then I can give you another one. Or if you didn't do well on that one, we can reiterate what we did the previous week and figure out why you didn't do it. As opposed to 2 weeks, now I got to wait 2 weeks to see if you got it right or if you didn't get it right.
All right.
And then we got to process that. So I can see how from week to week it would be going week to week as opposed to 2 weeks would be better. And then the other thing I want to say when it comes down to individual therapy, we mentioned this again in the previous episode about asking questions. And asking those questions, man, can be anything from talking about your childhood to like right here, right now. And while we may think those things are insignificant, people think that those things are insignificant. They really do matter. For me, I guess you can say I'm considered the middle child. I'm one of 4, right? And so it was my oldest brother, and he had that title of oldest brother. And then it was myself, and then it's my sister. She had the title of being the only girl. Right? And then I had my baby brother, and he had the title of baby brother. And even to this day, people would say to my mom if she's introducing me or if I'm telling them who my mom is, it's like, oh, I didn't know she had 4. And I'm always the one that they conveniently forgot about. Even though I was the baby, however, for about 5 or 6 years before my sister came, but people just didn't remember me. Well, that affects me, right? And it affected me. I guess it could have been negative because as I got older and once I got into really undergrad, started figuring out finding my way and putting myself in the forefront, right? Because now it's 4 of us, but don't nobody remember Curve. Nobody know Curve. And that just kind of propelled me into just kind of pushing myself along the way. And that's me being self-aware about it. Initially, I didn't recognize that. I didn't realize that. And when you come to therapy, stuff like that will come out. And it's different for everybody. You can be somebody can have that same birth order as myself and of 4, and it not affect them in the way that it affected me. So we individual therapy, it is just that. It's individual to that person. And again, like we've mentioned before, that session is only for you. Whatever you want that session to be about is going to be about, for the most part. And you said something too about that, that therapists sometimes can lead. Or there are times, someone come in, I might have a thought process, okay, this is what we're going to discuss today based off of some other things that has come about. What do family therapy look like as opposed to individual?
I mean, it's kind of. I'm not gonna say it's kind of simple, because
for us it is.
Yeah. I mean, but when you break down the word family therapy, is just a form of treatment designed to address specific issues affecting the health and the functioning of a family. Family therapy can be used to help a family through a difficult period. You mentioned major transitions, or mental or behavioral health problems in a certain family member. And understanding that when we're in a family unit, what affects one individual can have a direct impact and effect on other members in the family. So therefore there can cause some dysfunction within the family unit in addition to other things.
Yep.
I think Ty pretty much summed that up. I think, when you're looking at family therapy, I think a lot of times people assume or define family just to direct correlation as to, my mom or sister, sibling. But I think family therapy in terms can be anyone that you value in your life, or who has a substance role, a role of substance in your life, because family looks different for all of us in terms of who we interact with and who we engage with, and sometimes the people that we know best, or sometimes the people that know us best is who we perceive to be family. Traditional family therapy does consist, generally of your parentals, and children and things of that type of form. But as we see, with life, things are changing that dynamics as society continues to advance, and as we continue to redefine what family truly looks like.
I like how you said family goes beyond individuals. It goes into the group. You're looking at the family as a whole. Then they got something called family systems therapy. But looking at the dynamics of it, you're looking at the group as a whole. We hadn't mentioned this, but I guess you kind of just alluded to it just now about blended families.
Families, right.
And then even with blended families, like you got to think if a single mother has one child, and then she meets a single father who has one child, and those two get together, those children are used to being the only child.
Maybe.
Right? Maybe, yeah. They could be used to being the only child. Or them being a group together, like the mom and the dad, the mom and the child and the dad and the child. And now they got to come together and figure out how we're going to do this thing. Not only about how they individually feel, but systems, like who is going to be the disciplinarian, who's going to it's so much.
There's so many different avenues that you can go in when you're looking at family treatment, and sometimes a person may be seeking individual's treatment, especially when you're dealing with children. Oftentimes family treatment or family therapy is going to be strongly encouraged, and in some instances mandated, because the really direct influences of a child or a young adult is going to be really associated with their family, whoever they're being brought up or raised in the system, or of what they're experiencing is really going to be controlled by who they're around, who they have that close connection with, and so oftentimes I know from practicing, that's what was expected working with young children, is family therapy had to be a part of their treatment. And I think when you're looking at the dynamics again of family, you really have to kind of explore a little bit kind of what Ty was saying, is that the decisions and the behaviors and the actions of individuals within that family have a direct and indirect influence on those who are directly connected. You know what I'm saying? And especially when you're sharing a household or a space, and just like you mentioned, blending families, you talk about it from a disciplinary action, but I think about it even from the aspects of, really, for a lot of people, sometimes your home is your safest spacing. And so anytime someone else comes into that spacing that you're not 100% comfortable with, it's just like having company. It's even in your own home, it's good, but there's certain things you may or may not do or engage in because you have company. And until you get to a place where you can feel comfortable with that person, it's almost like they company. You know what I'm saying? Even though the dynamics of the relationships, the titles change, but like you company. And so we have to get into that adjustment in that climate, or flip the opposite of that. You may have been in a family unit and now you're separating. You know what I'm saying? Or you're seeking a divorce, and so the dynamics of a family is changing. You're still a family, but we're not staying in the same household, and so we may have to go to therapy to really just kind of process through the emotions surrounding that separation, the emotions surrounding what that is going to look like now, where we are spending weekends with each other. Now we may be spending every other weekend, or just summers, or whatever the case may be. And a lot of times that's hard for every person involved, especially when children are involved, or especially when there's still a lot of emotion surrounding that aspect.
Yeah, as you're talking about it, I don't know. Y'all know about that ACE score?
Yeah.
That adverse childhood experiences.
Mm-hmm.
And then you said safe space. And it's like, man, how important is family? Like, I was extremely blessed not to have to experience, everything that adverse childhood. And when I say ACE score, I'm talking about adverse childhood experiences. That's what ACE stands for, ACE. And that score, the higher the score, if I'm not mistaken, the more the more opportunity you have to the more open you are to mental health issues and illnesses
And other.
because of what you've experienced. And we all know trauma comes from what you experience. And so the more negative things that you experience, that's adverse, the more negative things you experience, the more likely you are to have that trauma, which then is going to affect your brain activity. That's going to affect how you see the world, your perception of the world. And
It
if
can.
It is. What you mean?
I think it can because, using from my own, and I truly support the ACE, but I also think there also are your rules of exception. I think, because when I completed the testing, I think I scored maybe like a 8, 9,
Okay.
something like that, which is really classified as a higher level of adverse trauma and experiences. And based on what they said, is likely to occur by grace did not happen to me. But again, that's why I say it can truly impact you, and it's not uncommon, but it does not mean that just because you have that level of scoring that you ought to automatically get placed into that category. That's what I was trying to say.
Oh, okay.
Not
Yeah.
discrediting the
Yeah.
value of it, but not just saying, automatically if you're administered that test and you score a certain rating, that it automatically means you're severely mentally ill or anything in that capacity.
Oh, definitely.
Yeah.
And even when I scored it, like I think I come from a pretty good family. But when you start looking at like some of the experiences that I've witnessed, either directly or indirectly, that score goes a little bit higher than I would want it to go
Right.
up
What you
because
feel
of the
comfortable with.
indirect exposure and the physical location that I was at. Like, you see stuff because you in a certain area of town or a certain city or a certain state. Man, I couldn't imagine what it would be like to be in some of these places that we hear about on TV, but that's another subject for another day. But family therapy is important just to be able to process. And when we're thinking about trauma, that's what we're thinking about,
And
processing.
I like how you mentioned that though, because I think oftentimes people don't understand the significant impact of our own decisions or our behaviors, because when we're going through it, we just trying to get through it. You know what I'm saying? But really the decisions, the behaviors, the location, because where I choose to stay at, really there's a lot of dynamics in there. One, housing availability, financial situation. So there's a lot of things as an adult that I'm trying to encompass, but that's a direct impact to my child too as well. The things that you're experiencing and how your score, as you acknowledge, is altered by decisions that weren't made by you. And this is why the dynamic of family therapy is so encouraged, especially amongst children, and oftentimes needed, because there are these direct consequences that are not a result of this child's decision, right? And a lot of times their behaviors or their responses to certain things is because of these indirect exposures or experiences that they are having, that they really don't have a way of changing it. I cannot want to stay in the neighborhood as a child, but if my family can't afford to live over here or to drive this or to whatever the case may be, we just can't afford it. And that's my reality. And so, again, that can create, more likelihood to crime exposures, more likelihood to gun violence or whatever the case may be, or access to drugs or whatever the situation was, which I think, as you mentioned and kind of stated, increases the number or frequency in our A scores.
And when you say these decisions that I didn't make, that goes into couples therapy, marriage therapy. Like these husband, wives, these couples, what you do affects the people around you, the kids, and everybody around you. when we when we picking people, I don't even know if we realizing. I don't think we realizing what happens. You know, whatever that person went through with their family, growing up, can influence how your family dynamics is, how they're going to discipline their kids or raise their kids, or what ideas are important to them. And even with family, I mean not family, couples therapy, that can come out as well. If we are not, if there's not an issue, there's not a problem. Let's say we're doing pre-counseling before we get married or before we take the next step to whatever commitment it is. Now some of those things, these questions that the therapist is doing, or these exercises. I love to do exercises with couples. Couples is my favorite. It's my favorite form of therapy. But these exercises that we do will bring some things to the forefront that wasn't necessarily there. You know, people don't always talk about religion or spirituality. People don't always even talk about sex and what I like, what I dislike. It just kind of happens, right? But when you're in that therapeutic setting, it's like, okay, let's see how you really feel about this. Where, what do you really want, or what do you really not like? Yeah, that's. I ain't mean to kind of go over there, but what do you think about? What do y'all think about with couples therapy?
Couple therapy for me is very vital and important. I think it is really significant, and I like the concept you introduced of probably being more kind of taking a proactive stance towards it, to bring the dialogue and consideration of a person's upbringing and other dynamics to how it is affecting the relationship. I think sometimes, when people, that seems somewhat of a foreign language to say, I'm going to go to couple therapy, but we're not having relationship issues. Is as if you're trying to create an issue, but it's actually giving you an opportunity to really do and look at things in a different light. People oftentimes don't want to go to couples therapy until an issue has already, until something has escalated. But sometimes, like you said, there are signs in the beginning that let you know, okay, there's some things we don't agree on. And I think as therapists, we are mental health professionals. We have the ability to bring it out and kind of work through those things a little bit differently when there's not this defense mechanism of an issue already being present. And I think it's important to really think about, is it couples therapy that's needed, or is it individual therapy that is needed? I've had couples come before, and really they were having couple issues, but a lot of the couple issues they were having is because individually they hadn't addressed certain things. And so it's hard to work towards a couple's goal when individually we have so much we need to accomplish. And so, the recommendation was made, let's focus on getting you guys involved in some individual therapy first. Not taking away from what you're experiencing, and maybe even, making sure that you have an outlet where you both kind of get your own needs accustomed to. So then as you're growing and advancing, now when you come back in to have this couples advancement, you're able to do so from a free space. Where because in couples therapy, I'm not saying who's right or wrong. You know what I'm saying? I'm trying to find the medium and get to you guys. But in individual therapy, you really get to explore and talk more about what it is that you specifically need. So I like couples therapy, really encourage it, but I also think you have to be conscious of when you engage in such treatment.
And you can do, I've seen people do couples and individual, like they'll have their own own individual therapist, and then they'll have the couples therapist. Maybe they had the individual before and then decided to do the couples thing. And again, going back to not necessarily assessment, but we can say in consultation, that can be kind of discussed in the consultation. Do we need individual as opposed to couples, or do we want to try it this way? And then when you, I also like when you said something about being on the defensive. When you're doing when there's an argument, right? or when there's a disagreement, sometimes we're just trying to win the we said this in what the episode about
toxic communication.
Sometimes you're just trying to win that argument, or you're trying to get your way in whatever the problem is, as opposed to when you're coming into therapy, you got an unbiased person who's there to really get to the root of the problem. Maybe the root of the problem is trust. Maybe the root of the problem is communication. You know, somebody saying, well, you need to be in the house by 1 o'clock because you're a committed person. Maybe it's not 1 o'clock. Maybe 1 o'clock isn't the number. Maybe it's just trust that we're dealing with, and we need to figure out how to establish that and make it so that one is not that. Well, I don't even want.
Well, I think too. I like what you're thinking about, because to me, it's about identifying those triggers. Because I think that's what you're going to, and that's what you're kind of referencing when you say looking at the bigger picture. Because in a relationship, we can have a disagreement, but what you said to me may have triggered something that occurred to me in my childhood that you didn't even mean it in that way, but because that's been my experience with people trying to tell me what to do, I don't like that, so it isn't about what you're saying or even about what we're discussing, but it's more about how that's making me feel. And again, that's sometimes why we have to revert to potentially seeking individual therapy, because that's that's something personal that's really not about that person, but it's about what I'm experiencing on the inside and how I'm internalizing what we're having. You often can see this sometimes as well when people are engaging in people say argument, but I like to say sometimes just a disagreement, because it is almost like you can't really, I can't say that I was wrong, or, I'm not able to really take ownership for, my thoughts or my feelings. And that, again, is personal. That really has nothing to do with the other person. And it can come from pride. It can come from whatever, but it's just the lack of being able to really say, you know what, this has nothing to do with XYZ. This has something to do with me. And again, I like couples therapy because sometimes it explores that. You know what I'm saying? So I think you just, as a person, you really have to choose your fit. What works for you and what are you in need of? Is this a couples issue? Meaning that this person, is a trigger in how we communicate and how we talk to each other, or how we work through things are unsuccessful? Or is it that I have some personal issues that I'm going through and I'm dealing with that I need to seek assistance and get clarification on so I can better serve this relationship?
Yeah. I like, we can talk about couples therapy all day. I can dig that. Even with the rules to fighting, right?
Right.
Because sometimes when people are having disagreements, what do? They tend to go from one situation to the next instead of figuring it out. But outside of, so we talked about individual therapy, we talked about family therapy, we then eased over into couples therapy, group therapy. Like I said earlier, there's no real difference between group, based on the studies, you're gonna have studies that say individual is better, you're gonna have some studies that say group is better, but they about even, right? So we can't really for certain say that one is better than the other. One of the things I like about group therapy is you get it's a ideal of what real life is about, right? Because when you're in individual therapy, that person's reporting what things were like in between sessions. When you're in a group setting, sometimes you can see how people interact with others. And based on what they go into group therapy for, that can be really significant. It can be really relevant because I can see how you're engaging people. I can see how your communication is as opposed to you just telling me. And it's an opportunity for you to utilize some of those techniques and coping skills that we would get right there in that setting. Not just in a role model and not a role play exercise, but just amongst other group members. I like that about group therapy.
When I think about group therapy, though, I think about the idea of the support that group therapy basically creates. I think a lot of times when people are experiencing situations, it's easily to feel like I'm the only person going through it, or this only is happening to me. But when you're getting to it in a group and you're hearing other people share their experiences, and you're saying, okay, wait a minute, you know what I'm saying? It kind of normalizes, what you're encountering, and really can be empowering in, seeing people who are transitioning through it, or people who've came out on the opposite side for it. And I do like the aspect that you said. I think group is beneficial depending on what the actual situation or circumstance is. I think it also gives you an opportunity to really be able to openly create a relationship with somebody who really can share your experiences in terms of really knowing kind of what it's like to be going through that. I think you're going to see that dynamic a lot in like people who suffer with addictions, or individuals who may be experiencing grief or loss. That's when I feel like are some of the most significant times when group therapy is probably the most powerful and influential, because that's the times when people really get to really just be kind of release themselves in a space in where there's no judgment, because everybody in here is battling something or is experiencing some similarity, versus where individual, again, it kind of just feels like, why am I feeling this way, or I'm really angry that so and so passed away. But when I get into a group and somebody else says, you know what, I'm still angry and I'm still hurt about this, and it's been 10 years, versus, you know what I'm saying, just me feeling like I got to be the only person. And I think individual and group, I don't think that you can kind of weigh them out as which is beneficial. I just feel like it's based on what you need at that point, where you are. And oftentimes you may start out an individual, and your therapist may offer you to join a group in addition to receiving that individual treatment, as a way to really kind of build that network for those people who may not already be having it.
Yeah, that's a good point about the benefits of individual and group. And ultimately, I think it comes back to the actual person. The therapist who is leading the group, and the therapist who's doing the individual therapy. You can't get beyond that relationship or that alliance that you have with that person. I'm saying relationship, I'm saying alliance, but it really boils down to a vibe. Like, do this person get me, and do I get that person? And what'd you say, energy? Yeah, I'm with that. And we got on here talking about payment, and very much like the last episode. I don't know, you might have more insight on this one. Group therapy, do insurance pay for that? I'm still learning the insurance part of it. Currently, the private practice I'm at, I don't do insurance, but I'm learning more about that. Do you know, Ty?
I don't.
I do know I've had some individuals who have gone through group. There are some insurances that pay for group. I think you really have to be able to justify. And again, kind of how we mentioned in the other episode, it kind of has to be documented as being valuable to your treatment. And so you really may want to explore that from a therapeutic stance with your insurance company, just to make sure. Also, you too want to look at the institutions, because as you indicated, some private practices may not offer that type of treatment. So looking at it, and it depends. And sometimes groups aren't really cost based in terms of, sometimes because they can be just support groups, so it may not be any cost associated. So it just kind of depends on what kind of group you're attending. But from a therapeutic standpoint, again, there are some insurances that pay for it. I know that because I provided group therapy before. But again, to say that yours will do it is best to make sure you check with your actual insurance company.
I do know, like you were saying, support groups are typically free. Sometimes they refer to them as wellness groups.
Right.
A lot of group therapy that I know of around this area is addiction or substance abuse oriented, and I believe insurance is paid for that. But when we're talking about other types of groups, then that's something you have to, number one, talk with the therapist about, and or the person that's providing it, and then your insurance company as well. Also, typically, that group therapy is the less cost if you did have to pay for it out of pocket. I have no idea what that cost would be. I can't say it would be half or not, but it would be significantly cheaper than individual therapy in most cases. Because there are a couple of people in there, so they're all paying a smaller amount for a smaller portion for the same amount of time, basically. I don't think we've mentioned this, but most of those sessions are 60 minutes. I think groups are more like 90 minutes. But you definitely have 60 minute sessions, 50 to 60 minute sessions when we're talking about individual, when we're talking about family, and when we're talking about couples therapy. Group therapy is a little bit different in that they may do 60 and they may do 90, depending on what it is. And then there are some other groups that has to do with domestic violence.
Right.
And that are, you have to go through the courts and all of that stuff. Or sometimes you go through the courts and they say that you got to do that as part of the conditions that they assign to you based off of whether you've been charged and convicted of it. But with treatment, there again, talk to the person that you're inquiring about these services with, and then also look at your actual insurance company. Over the last 2 episodes, we've given you guys, we've talk about just the initial thing, finding a therapist, why therapy is good, how to go about that process, and then we came back and followed it up in this episode about the different types of therapy, which is a pretty good overview. Maybe a year from now we'll come back and do it again. Again, if you guys have anything that y'all want us to talk about, feel free to reach out to us and let us know. Once again, I'm one of your hosts, Curvin. We also have D. We also have Ty. We're on Facebook. We're on Instagram under Speaking with Gravity. If we said something to make you think that you can use therapy or seek a professional in your area, then reach out to us if need be, and through a message, DM or something, and then we'll try to get back with you and point you in the right direction. Thank you to Vision Winning Productions. Thank you to all of those who support us and encourage us to continue to do what we do. And you're going to need to stop playing that while I'm doing my outro. Thank you for taking the time to listen. You could be doing anything right now, but you chose to listen to us, and we appreciate that. Again, shout out to anybody that listen and support us. Remember, we're therapists, but this ain't therapy. It's a podcast.